So here we're going to do a laser treatment to the lumbar spine. What I'd like to do is I like to use the roller ball applicator, which I think is excellent. This roller ball contacts this fleshy part of the lumbar region. It provides a great, I think, tissue release, not to mention it allows for the laser to get in deep into the area, because the roller ball, by depressing the area, we're actually pushing in the fluid out of the area, allowing for that laser energy to get deep into those lumbar joints. So what I do to get this thing started is, over on my screen here, I'll use the influence technology that's built into the device, and I'll go to protocols. The beauty of this is I get to select the height, body type, and skin color of the patient. Once I've selected that, I'll go to the area. We're going to be working on the lumbar spine. For this particular treatment, we're going to treat a lumbar sprain strain. So I'll hit that tab, go to next, and it lays out the treatment for me. We're going to use 11 watts of power. This treatment is going to be about 6 minutes. Now this patient's in acute pain, so I'm going to double this treatment so that the patient actually gets 2 treatments of 6 minutes at 11 watts. And then the pulse rate is at a continuous watt rate. So we're going to go ahead and hit that standby button. And I'm going to use that roller ball and depress the tissue. What the patient's going to feel here is a warming sensation. Feels a little toasty, but not too hot. This particular treatment is going to be about 6 minutes. And I'm going to do 6 minutes on the right side of the lumbar spine, and then I'll do another 6 minutes on the other side. What a great way to get inflammation down after a lower back strain. Also a great way to promote healing at the cellular level in the tissue. Great way to manage pain as well. I like to use the laser therapy in conjunction with my soft tissue work. Soft tissue work meaning Graston technique, myofascial release, even some fascial stretch therapy. The laser therapy is a complement to those treatment protocols in my practice. And then of course, when we're done with those treatments, that's typically when I deliver the chiropractic adjustment. So the first part of this treatment, I like to keep the patient static, so the patient's face down. And then for the second part of the treatment, I'll have the patient actually go through some motions, through some movements in the lumbar spine. Okay, you can stop that.